So, welcome back once again, and good morning, good afternoon, or good evening, depending on when you are listening to this. So, hopefully, all of you have gotten your elected official address and, most importantly, the advocacy letter to me, because remember, you cannot finish the rest of the assignment with this worth 100 points unless you get those letters back to me. When you send them to me, I will send them back to you because often they need just a few tweaking here and there. Okay, so please, if you have not done that, please remember to do that ASAP. So this presentation will be about, some factors about physical abuse. What happens in physical abuse of children? Remember, most of the abuse and neglect that happens with children happens with someone they know, okay? And often it's not that parents don't love their children or guardians. A lot of times they haven't been taught how to parent children themselves. So some of the risk factors, obviously, excuse me, if parents are depressed, that may cause them to physically abuse their children. Sometimes there's personality disorders, not in a high percentage of cases, but sometimes. And then serious life problems like domestic violence. And that you'll be hearing a whole speaker on that very soon. And then lack of coping mechanisms. If they're having, these stressors and other stressors in their lives, they have not been taught how to cope with these stressors. And so children are right there. So often they take their frustrations, their anger out on the children. Financial stressors, especially during this, we're still in the time of the pandemic. So that's a big one. Sometimes, not always, they have less education, so they're not sure how to parent their child or their children. And housing concerns. Sometimes people have lost housing, they have substandard housing, they're really worried about it, they're frustrated, and they take that out on the children. And some are mentally ill, but again, that is a very small percentage. So you have family risk factors. They're isolated, they may live out in the country, or maybe they've just moved here, or they don't have really any family or not many friends here. So they have poor relationships or no relationships. They're unemployed, during this time of pandemic. Many individuals have been unemployed because they can't find childcare. Childcare is, difficult to find and sometimes difficult to pay for too. And maybe illnesses, and that brings a whole lot of stress with it. So these are not excuses, but they're just reasons. So one needs to figure out what is the reason before you can really assist the parent or guardian. You have to kind of know what abuse looks like. So fractures in infants under 12 months, strong indications of abuse if it's a fracture. Infants usually 99% of the time do not get fractures. So if they get fractures, it's a pretty clear sign that it's abuse. Multiple fractures, 2 or more lines of fracture on the bone. So medical professionals are trained to know this, okay? But sometimes as a CPS worker, one might accompany the parent to the doctor, and the doctor may say, look at these x-rays. And you may be looking at these x-rays with the parent. So it's a good idea to know, what do these look like? Sometimes the parents are in denial many times, and they need really strong evidence that, yes, this is really abuse. And spiral or torsion fractures, the bone broken by twisting the infant's arm, especially children under 12 months of age. Fractures, a subparietal, the bone is broken, but there's no change in its contour. It can lead to increased calcium deposits around the bone. It could be a dislocation. Bone is separated from the joint. Again, These don't just happen. It's usually a result of a child being abused. So this is just another picture, a radial head dislocation of the bone. This is what it would look like. And green stick fracture, one side of the bone is broken while the other side is bent. Not really, happy pictures to look at, but it's a really good idea to know, what does this look like? Head and internal injuries, hematomas, collections of blood that form around the surface of the brain caused by a severe blow to the head. Hairline fracture, subdermal hematoma, very dangerous. You can see in the bottom, it can be caused by shaking a baby. A baby's brain is like, if you think of a bowl of Jell-O, so if you shake the baby, the brain is literally bouncing back into the back of the head, which can cause brain damage and the child to die. Okay, so there can be a ruptured liver or spleen. Shaken baby syndrome is responsible for over 50% of non-accidental deaths of children. 50%, that's pretty high. And again, this is what it looks like, the torn vessels when a child's head is shaking back and forth. Burns, often tap water burns, often result from frustration over a child's behavior. Holding their hand under hot water. Again, you may say, who would do this? How could this happen? But these are real incidences that really do happen. Pattern burns from an iron, cigarette burns, and that kind of thing. Rope burns. The location of a burn is important, and also the parent's explanation. So you always have to listen. Does it make sense? Okay, and remember, we haven't done the PowerPoint on reporting, but I will do that. But New York State says that if you suspect child abuse or maltreatment, you can call it in. You don't have to prove it. You can call it in. And as a teacher, an early childhood educator, a social worker, you are a mandated reporter, which means you need to call it in, or there's fines for not calling it in. Okay, but you would need to call it in if you have reasonable cause to suspect. And if you do, if it's not of a sexual abuse nature, if it's one of these, you will say to the parent, I'm a mandated reporter and I need to call this in. You would probably tell the parent that before you have the conversation. Or if you're working in a child care center or in a public school as a teacher, there may be somebody else you need to report it to, the nurse or the principal. Most places have specific reporting systems. Some behavioral indicators. Abused children do not cry in general, but cried hysterically when being examined. Obviously, if they're used to being physically abused and hit, they think anybody that's going to come near them and touch them is, going to hurt them. And they showed no expectations of being comforted by their parent or guardian, because most of the time, these are the ones that abuse them. Okay. Or they can be very passive, because a lot of times children think, if I just sit really quietly, nothing will happen to me. Because remember, children are egocentric. They think they're the world revolves around them. Some other behavioral indicators. They have an inability to enjoy life. I remember I worked with a woman once, and when she was 3 years old, her brother was born, and he had some, I think it was medical issues. And so the mother made her sit in a chair for a very long time. And as a grown-up, and I worked with her, she really could not enjoy life. I said, well, what makes you happy? And she said to me, I can't really use the word happy. I can only use the word content. So, they don't know how to enjoy life because they're so scared that something's going to happen to them. They're hypervigilant. You may see this on a test. Hypervigilant means that they're always on alert. Okay, they're always, watching for sounds. They're basically trying to protect themselves because a parent or guardian honestly has not protected them. So they're being always on alert. And sometimes they exhibit compulsive behavior, okay, because they don't know what to do in a situation. So rather than really clearly thinking about something or following rules and expectations because there aren't any, they act impulsively or compulsively. They feel out of control because they have not been taught how to control their lives. They have really adaptability to people and settings because they want to please. They think, oh, if I do something exactly like this person wants me to, I won't get hit or I won't get yelled at. Okay, so they're thinking, how can I? They feel out of control, so this is their way of kind of controlling the particular situation. And they're fearful of failure. They perceive abuse as retribution for their failure. Remember, they are egocentric. They think the world revolves around them. So, if somebody yells at them or somebody hits them, they think, oh, I'm a failure. I must have done something wrong. So that's why, again, they try to adapt to people and settings. Verbal inhibition. Again, they try to remain quiet and maybe I won't get hit. Often regression is a defense. You may see children resort to bedwetting or some other infantile behaviors, sucking their thumb. And abusive parents generally have not learned to get their needs met in an appropriate way, so they lash out at their children. So if you were working with somebody like this in counseling, you'd have to teach them how can they get their needs met. How can they separate their feelings from their actions? In other words, they are feeling very stressed, and so they immediately, impulsively take it out on their children. So how can they separate that so they don't have to act in a negative way on their feelings? To determine they are responsible for their own actions and not for the actions of others. Okay, so how can they learn to control their own actions? And how do you make decisions? Okay, how do you make good decisions? Again, so you're not abusing the children. How do you delay gratification? When you have children, those of you that have children know, it is all about children. Okay, so if your child needs something immediately, and they really need it immediately, and you were going to sit down and do your homework, you might have to delay that. Okay, or you were going to sit down and watch your television show. You might have to delay that. So you can teach people how to delay their gratification. Sometimes Munchausen syndrome by proxy, the parent or guardian intentionally harms the child to get attention, that should say from others, sorry, to get attention from others. Mary Beth Tinning, it was a high profile case in Schenectady. She had about 8 children, I believe. She would rush her children to the hospital. This was back in the 70s, 80s. And they thought that the children had SIDS, sudden infant death syndrome. And she would rush them to the hospital. They would stop breathing and they would die. Until, I guess she had adopted 2 children. SIDS is usually hereditary. And she had adopted two children. And she did it with one of the children, and then that was suspect. So she was intentionally smothering the children with a pillow before she brought them to the hospital. So that was Munchausen syndrome by proxy. Very sad. Sometimes they've been, lots of reasons. One of them is sometimes they've been rejected from others, and it, kind of creates rage in the parent. So, that was a very, you will read about this in your book too. That was a very quick, reasons and, why parents do this. But again, I want to emphasize that most parents or guardians, they really do love their children. Now, some, there are exceptions to this, but usually, one of the reasons, and they don't know how to parent their children. Okay, so this is recorded, so you can take a few notes, go back and look at it, and enjoy the rest of your day. Oh, one last one. Maybe unable to differentiate herself from her child. Okay, in other words, she has not really fulfilled all of her needs, so she's kind of projecting them onto the child. All right, so now have a good night, and we'll see you in the next recording.